One of my favorite procedures to do is a cervical artificial disc replacement. It's a very minimally invasive surgery that can rapidly get patients back to their prior functional level. Patients that come in to see me with a need for this type of surgery generally have an injury to the disc, which is the cushion or spacer between the bones. And you can see it in the model here, right behind that in yellow, we have the nerves. So when the disc is injured or it's bulging or herniated, it often puts pressure on the nerve, and that can cause a lot of pain, not only in the neck, it can also cause headaches, it can cause shooting pain down the arms, one arm, even both arms. In really severe cases, it can even affect the legs. In a cervical disc replacement, the patient is laying on their back, and we make a small incision on the front of the neck off to the side. And then with special magnified vision and lighting, we're able to work actually through a small tube to get down to the spine after moving all the important structures out of the way. Once we're safely docked onto the spine, my first job is to take all the pressure off of the nerves. That often involves removing things like bone spurs, removing a herniated disc, and being able to see with my own eyes that the nerve in the spinal cord is now completely decompressed. Once that's been accomplished, we can't leave the patient with a gap in their neck where the disc used to be, so we need to fill that space with an artificial version of the disc, and that's an artificial disc replacement. And as you can see in the model here, that's made of plastic and metal, and the nice thing with a disc replacement is it still allows the patient's neck to move like a normal disc. So even though the disc has been completely replaced, we don't have to restrict the motion in contrast with a fusion where the bones are locked together. The nice thing with the disc replacement is it allows for more range of motion, and we're not waiting for bones to fuse together.